I was admitted to the hospital on a Sunday. Came in coughing up blood. I was diagnosed with germ cell cancer, which is the same cancer that Lance Armstrong went through. Probably spent a good 45 to 50 nights in this hospital, and I really got to know the nurses up on the 5th floor very well.
It started when I came into the ER. My husband had been brought in via ambulance. He is a handyman by trade, and he decided that he was gonna maybe go off a roof about 25 feet. And that's pretty much what started it, is that I couldn't get anyone to give me significant information.
The patient's voice is critical to the care they receive in any hospital, but sometimes it takes a back seat to the medicine. The healthcare team is so focused on saving lives and curing diseases, they can often overlook an essential part of the medical equation, the patient experience.
There were many mornings that my breakfast was delivered to me at 6:50 in the morning, and I was asleep. I mean, you're awoke every 4 hours when you're here. You're tired. I'd wake up only to find cold food in front of me.
I was actually in the waiting room for 2.5 hours. And although the liaison came out and tried to tell me, I literally said, I know you're not a medical person, but I need something. Can you nod? I asked her if she could nod and answer. And then I started asking her questions. Does he have a head injury? Did he have a spinal cord injury? I had no idea.
Painful to hear, but easy to fix when care is focused around the patient experience. CHI Health uses that kind of feedback to improve patient care, and it comes from patient advisory councils.
Really, we talked about trauma,
where people share their own experiences so CHI Health can learn how to do it better.
It's not something where you're writing out on a comment card and dropping it in a box and you never hear anything again. When you actually have a group of 15, 20 people that are involved, that are bringing issues to you and talking about things, committees are formed, things are followed up on, and you're getting response back from them.
One of the best products of this group so far is...
The councils meet once a month. They're made up of patients, families, and staff. They're not dictating medical practice or protocol. They are helping improve the delivery of care from a vantage point only a patient and their family could know.
Going through our day, being on the other side of the bed, we may think we know what's on our patients' minds, and we even ask, but when you're engaging with a sick patient in bed, they don't hear half of what you say. We make assumptions about what they're perceiving.
There are so many things that go into that care, whether it's from being admitted down the hall, taken to the floor, working with your nurses, working with your doctors, the food, the atmosphere, all the way through billing to the end. There are so many cogs that work into it, and if one of those is just off, or if one of those breaks, it reflects poorly on the entire system.
That's why Creighton University Medical Center reached out to Eric Yarwood and Candy Deacon and extended an invitation to be on the council. Both had very different stories, different concerns. Yarwood as a patient, Deacon as a family member. But both were excited to be able to come up with solutions to patient problems, to change things that on the surface may not seem like much, but to the patient, it's part of the experience.
And if we can make a couple little changes just to make that experience not be as scary, as stressful, as nerve-wracking, I'm there.
How are you feeling today, Vernon?
It starts small, and this is the way to do it, to kind of educate people and move things forward.
And the council is already seeing results with simple changes in the ER and on the hospital floors, like wait times posted for medical tests and procedures, and medical liaisons delivering critical information to loved ones waiting in the emergency department. Inexpensive, easy fixes that go a long way in building relationships. Before the advisory council, Candy wasn't sure she could recommend Creighton University Medical Center to family and friends. Now, it's a different story.
They saved my husband's life, and they're listening. People just want to know that they're being heard. So, I feel happy.
Healthcare has always been driven from the top down. Now, at CHI Health, there's a new voice at the table, showing what's possible when patients, families, and their medical team work together.
It's where medicine is going. It's where medicine should go. The patient feels like they're the center of care, they're the focus of everyone's attention, and that their needs are the highest priority.
For CHI Health, I'm Mary Williams.